Welcome. I'm so excited that you can join me today for this lecture. I'm sure that you're going to be able to get some excellent information that will help you improve your health. Before we get started, let me introduce myself. My name is Dr. Nadia Malik. I am a chiropractic physician, board certified in clinical nutrition and internal disorders. I've been in practice for well over 30 years, and most of those have been in the field of natural and functional medicine. Now, my focus is predominantly on chronic illnesses, and I love to work with quite a few thyroid and adrenal issues, gut problems, autoimmunity, and anxiety. Having been there myself, I understand how that feels. I'm also the co author of Cracking Your Thyroid Code and co founder of Wellness University and the cookbook, which we should be getting published fairly soon. You can find me at drnadiamalik.com and thethyroidcode.com, and I currently practice in the Lake Worth area, and I work with clients from around the globe and locally as well. I'd like to just go through a little disclaimer before we get started because it's really important to understand that the information that you're getting here today is educational. It's for the purpose of helping you make better decisions, but it is not a substitute for medical counseling, and it is definitely not intended for the diagnosis, treatment, or cure of any medical condition. It's always advisable that you seek your healthcare professional's advice before you undertake any kind of treatment. And if by any chance I should mention any supplementation, please understand that these are not have not been evaluated rather by the Food and Drug Administration. So let's go ahead and get started. The secret to a healthy pregnancy. So if you're thinking of getting pregnant, this is going to be super important information for you to know because it's really important to understand that you have to be healthy in order for your baby to be healthy. And we're going to find out what potential issues could happen with certain health problems that you might be having. So what we're going to cover today is fertility, infertility, and pregnancy, and some of the main risk factors like hypothyroidism and the autoimmune connection, MTHFR and folate. We're going to talk about weight. We're going to talk about insulin resistance and adrenal dysfunction. Now we know that in the past, women really didn't think so much about, what they had to do to bear children. But today we live in a different world. It's much faster, it's much more toxic, it's much more stressful, and our bodies are taking a beating. As a result, fertility has dropped, and it is much, much harder for women today to get pregnant. So, if you want to have that baby, here's the information you need to know before you take that step. Let's begin by looking at fertility. And of course, fertility is the ability to have a baby. And infertility, of course, the inability to have a child. And here we're looking at that infertility actually impacts 6.7 million women in the US. That's about 11% of the reproductive age population. 11%. That's a pretty high statistic if you ask me, don't you think? And 25% of infertile couples have more than one factor that contributes to their infertility. So it's not just one little thing that's easy to fix. No, it's more than one thing. 12% of all infertility are because of weight, either too much or too little. Smoking is a huge issue, so we know that a large percentage of female infertility is caused by smoking. And of course, irregular abnormal ovulation accounts for about a quarter of all female infertile problems. Now, bearing in mind that if you're not ovulating, if that egg is not moving from the ovary into that fallopian tube to be fertilized and implanted, we have a problem. There's not going to be a pregnancy here. Plus, on top of everything else, about a third of infertile couples, the reason is you gentlemen, the male partner. And we're talking about risk factors in the male very similar to the female. smoking, alcohol, illicit drugs, weight issues. All of these things, gentlemen, if you have those, can impact your ability to have a child. So it's super important to not just deal with you ladies, but you gentlemen as well, to make sure that both of you are healthy in order to to ensure that you're fertile and you have a healthy child. So when are you considered infertile? Well, you are considered infertile if you have had unprotected sex for 12 months and you have not conceived. So, what of course do most couples do when that happens? What do? Well, you visit a fertility clinic, right? But here's some stats on fertility clinics that might actually shock you. The Assisted Reproductive Technology Report for 2012, and ART, well, that's just a fancy name for fertility clinic, states that 28 to 60% of fertility treatment result in implantation. So if we want to look at the other aspect of that, that means that 40 to 70% of fertility treatments fail. Fail. Not a great statistic, right? So, what would cause a couple to be unable to get pregnant or to have an unhealthy pregnancy or one that ends in disaster, such as a stillborn birth or a miscarriage? Well, we all know the common cause, right? We're talking about things like alcohol, smoking, RH factor, etc., polycystic hypertension, heart disease, kidney disease, all of which have the potential to not only cause infertility, but also physically injure that developing fetus. But what we're going to be covering right now is we're going to be talking about some of the other extremely important considerations when it comes to pregnancy. So let's start with thyroid fertility and pregnancy. And here we're talking about thyroid problems, whether it's hypo or hyperthyroid. But for the sake of simplicity, we're going to be talking about primary hypothyroidism because this is basically what's recognized as hypothyroidism in the conventional world. Now, those of you that have heard my lectures on thyroid know that there's well over 20 different patterns of hypothyroidism, but predominantly when a medical professional looks at your thyroid numbers, all they're looking for is that elevated TSH. And if they see that, then that's cause for them to go ahead and prescribe medication for you or hormone replacement therapy. But hypothyroidism is so much more than that. And hypothyroidism can create a slew of different problems as it relates to fertility and pregnancy. So let's go over some of these. And let's start by looking at a study that was published online back in August of 2015, but that was actually published in April of 2015 in the Reproductive Medicine and Biology Journal. The impact of elevated thyroid stimulating hormone on female subfertility. So in this particular journal, the this study was actually aimed to investigate the relationship between high TSH and reproductive outcome, basically infertility. And what they found was that there was an association between high TSH and a decreased rate of pregnancy. So high TSH, low rates of pregnancy. So again, if you have high TSH, you have to be well aware that this potentially could impact your ability to get pregnant. So of course, their conclusion was the result may reinforce the usefulness of screening for TSH. Well, of course, since thyroid issues have a a hand in fertility, it's so important to screen your thyroid to ensure that your thyroid is functioning properly before you attempt to get pregnant. In order for us to understand what makes thyroid dysfunction such a problem, we really need to look at the relationship between the hypothalamic and pituitary hormones. And this is what this slide is all about. So if you take a look at this slide, you'll see hypothalamus and anterior pituitary. Now, both of these glands live in your head. They live in your brain. The hypothalamus is part of your hippocampal area, and the anterior pituitary and posterior pituitary, which form the pituitary glands, sit in a bony protrusion called the sella tursicum. So, hypothalamus is sort of like your commander in chief. It is the gland that literally tells not tells, but rather assesses the state of your body. You know, kind of assess the state of the nation. Well, here we're assessing the state of the body. And when it detects a discrepancy in the signaling system, it tells the pituitary what to secrete through its own signaling hormones. So the hypothalamus produces gonadotropin releasing hormone. That's the hormone that you see to the far left. And gonadotropin releasing hormone tells the pituitary to release FSH and LH. FSH is follicle stimulating hormone. Now, follicle stimulating hormone is extremely important because it is the one that stimulates the follicle that holds the egg to release the egg. So you need to have healthy levels of follicle stimulating hormone in order to ensure that you have healthy egg maturation and healthy egg release into the fallopian tube. Now, once that egg is released into the fallopian tube, luteinizing hormone then tells the corpus luteum, which is the leftover shell from the release of the egg, to produce progesterone. Now, progesterone is your progestation hormone. It is the hormone that prepares your uterus for implantation. So you can see how important it is to have healthy levels of FSH and LH. Now, the next hormones you'll see are the growth hormone releasing hormone and somatostatin, which is also known as growth hormone inhibiting hormone. Now, both of those have an impact on growth hormone. Also extremely important for proper maturation, proper wound healing, proper repair, etc. Now look at TRH. TRH is thyrotropin releasing hormone, and it tells your pituitary to release TSH, or thyroid stimulating hormone. Again, we've talked about the importance of thyroid hormone, so you can see how important it is to have healthy glands in the brain doing their job. DA stands for dopamine, and dopamine is inhibitory to prolactin. Now, prolactin is a hormone that you need to be producing when you're pregnant because it helps your breast produce milk for feeding your baby. But what prolactin does, as we'll talk about in our next slide, is it actually has another action in the system. So you don't want to be having high prolactin levels when you're trying to get pregnant. Now, CRH, that's corticotropic releasing hormone, tells your pituitary to release a CTH, which tells your adrenals to release cortisol. So you can see that it's extremely important to have a healthy hypothalamic pituitary axis going on so that you have proper movement of hormones in your system and proper release of hormones in your system. Now let's take a look at hypothyroidism and infertility. With hypothyroidism, what happens is we have a decrease in gonadotropin releasing hormones, which leads to a decrease in FSH and LH. Now, remember how I said that it's super important to have healthy levels of FSH and LH to tell the ovary to stimulate that follicle, to release that egg, to prepare that uterus for implantation. So now when we have decreased gonadotropins, what do you suppose starts to happen? Less than adequate levels of FSH and LH, right? Which impact then the ovary's ability to produce healthy eggs. The other thing that we see with hypothyroidism is dopamine, rather increased prolactin levels because of decreased, typically, dopamine levels. So with increased prolactin levels in pregnancy, prolactin acts as an inhibitory signaling system to the ovaries, preventing you from ovulating properly. And the reason for that is because when you're pregnant and you're making milk for your baby, you don't want to be ovulating at that point in time. You want that ovulation to be paused so that your fetus or baby can gestate or develop properly. And once you've delivered the baby, after a certain amount of time, your body starts to ovulate again. But when you have elevated prolactin levels and you're not pregnant, then what happens is it impairs your ovulation, and that can lead to infertility. So here's a study that was published in the Journal of Assisted Reproductive and Genetics in February of 2015. Elevated serum thyroid stimulating hormone is associated with decreased anti-Mullerian hormone in infertile women of reproductive age. In this particular study, what they found, and let's before we go there, let me just explain what anti-Müllerian hormone is. Anti-Müllerian hormone is a biomarker that's used to assess the health of the eggs in the ovary. So the higher the anti-Müllerian hormone, the healthier the eggs. The lower the anti-Müllerian hormone, the less healthy the eggs and the less capable they are of sustaining fertility, or rather, for of you getting pregnant. So, having said that, looking at this, it talks about thyroid dysfunction and autoimmune thyroiditis are associated with fertility in women of reproductive age. We know that they're actually associated with infertility in reality, right? But what it says is that anti-Müllerian hormone may be affected by impaired thyroid function. So essentially, the conclusion was that AMH levels are inversely correlated with TSH levels in infertile women of reproductive age. So the higher the TSH, the lower the AMH. The more normal your TSH, the higher your AMH. So you can see how having elevated TSH actually decreases the viability of your eggs. So not only does it impair ovulation, but it also decreases the viability of your eggs. Now let's look at thyroid with pregnancy. Now in a typical pregnancy, thyroxine binding globulin or TBG rises, and it leads to an increased total T4 and an increased total T3. Now again, for those of you that have been through my thyroid lectures, you understand that the total number means that it's mostly bound to a protein, and the protein is your TBG. TBG is your bus, basically. If you think about the thyroid secreting thyroid hormone into the blood, a little bit of that hormone stays free, but most of that, probably about 99% or more, hops on that bus and is transported or travels from point A to point B. Now, when you overbind or when too many thyroid hormones are on the bus and not enough are free, you're actually going to have symptoms of hypothyroidism because there's not enough free hormone to do the job. The other thing with pregnancy is that iodine clearance increases, meaning that you clear out a lot more iodine than you normally would. And that often will lead to a low T4 and an increased TSH because we need iodine to make thyroid hormone. So as a result, you may see a lot of times pregnant women have like a big neck because their thyroid is enlarging due to the shifts and changes that occur with pregnancy. Now, of course, we know that maternal iodine will cross the placenta. So if you're taking iodine, you have to also be super careful, number one, to ensure that you're not an autoimmune issue, you don't have an autoimmune rather thyroid. But number two, to ensure that you're not taking too much, because if you take too much, just like it can with us, for example, if we take too much iodine, it inhibits our thyroid function. If too much iodine winds up crossing your placenta, it will inhibit that baby's thyroid function as well. So it's extreme. Iodine is a two-edged sword. You have to be super careful with it. The other thing that occurs with pregnancy is the human chorionic gonadotropin, or HCG. And yes, that's the exact same HCG that you see on all those HCG diets out there, peaks at the end of the first trimester. Now, HCG is typically produced when we're pregnant, but it has an affinity for TSH receptors, so it causes a false negative. In other words, because it binds to TSH receptors, it will block TSH. It will cause a slight enlargement of that thyroid gland, but it also make it seem as though you have enough TSH because your TSH receptors are plugged up by this HCG. So you kind of have to be careful too when you do the diet, because since HCG does have an affinity for TSH receptors, it isn't unlikely that it could do the same, cause a thyroid hypothyroid type scenario if you're doing the HCG diet. Okay, let's look at the autoimmune connection. Hashimoto's. Now, Hashimoto's thyroiditis is a hypothyroid condition, but it can both be a hyperthyroid and a hypothyroid, although ultimately it becomes hypothyroid at the end because the thyroid is completely destroyed. The problem with Hashimoto's is your immune system is making antibodies to the thyroid peroxidase enzyme. The thyroid peroxidase enzyme is what tells your thyroid to make thyroid hormone. Now, in this particular case, what happens is that these antibodies actually cause a problem in your system as well. So, if it's uncontrolled Hashimoto's, in other words, if you're not managing this properly, it could create a slew of problems during your pregnancy. Preeclampsia, for one, which is that dangerous high blood pressure where that can impact both you and your baby. Anemia, a low blood cell count, can actually impact the amount of oxygen that's delivered to you and to your baby while you're carrying your baby. You can have a miscarriage or low birth weight or even a stillbirth. And of course, Hashimoto's has been linked to infertility. Extremely important to make note or pay attention to ensure that you're not just checking your thyroid to see if you're hypothyroid, but that you're also checking your thyroid to see if you have an autoimmune issue going on. The other problem is, of course, the other autoimmune connection, and that's Graves' disease. And Graves' disease is hyperthyroidism. Now, in this case, your body is basically eating itself up. In hyperthyroidism and Graves' disease, the elevated antibody is to thyroid stimulating immunoglobulins. And the problem with that is that it stimulates your thyroid to put out a lot more hormone. Now, the problem with this is again the same, very similar issues to what you see with autoimmune Hashimoto's, excuse me, the preeclampsia, the miscarriage, premature births, the low birth weight, and the infertility. But the problem with the TSI antibodies is if they're still present in the system, and believe me, I've worked with Graves patients and I've seen these antibodies go down way into the normal range. So it is possible to really manage and control this. And I have patients who have been diagnosed with Graves who have had had a healthy pregnancy once we've gotten everything under control and had beautiful healthy babies. So don't think that because you have this that it's a hopeless case. It is not. It's manageable, and once it's managed properly, then the chances of you having a healthy baby are much greater. The problem, but what I was saying earlier was the problem with the TSI antibodies may actually cross the placenta into the baby's bloodstream, and they may stimulate that baby's thyroid. So it's super important to make sure that you have those antibodies under control, especially when you have Graves, to prevent that problem from occurring with your baby. So let's take a look at this other journal, rather, this other study. This study was actually done in 2014, and it's in the International Journal of Endocrinology, the high prevalence of infertility among women with Graves' disease and Hashimoto's thyroiditis. So the objective here was obviously to evaluate infertility versus Graves' disease and Hashimoto's, and what they found was that it was the prevalence of infertility was high in women with Graves and Hashimoto's and affected the number of pregnancies in young women. So obviously, if you have an autoimmune thyroid problem, you run the much greater risk of being infertile. Let's look at another journal here. This is a journal of obstetrics and gynecology, and this was actually published in July of 1985. Premature ovarian failure, its relationship to autoimmune disease. And what was found was that from these findings, review of these studies, the author conclude that an associated autoimmune disease or other evidence of autoimmunity is present in 30 to 50% of patients with premature ovarian failure. That's a pretty high statistic when you think about it. That means that up to half of women with premature ovarian failure have autoimmunity. So it kind of links the two together, and it's something that you really want to think about before you take that step into having that baby. So it's really the reason it's so important is because thyroid hormones are crucial, so important to fetal brain and nervous system development. So if you have hypothyroidism or hyperthyroidism that's uncontrolled, that's not been managed, that hasn't been brought in line, especially during the first trimester when that fetus is still developing, then it will affect that baby's growth and brain development. Bottom line, get your thyroid checked before getting pregnant. Super. So next thing we're going to look at is MTHFR and fetal development. So we're going to start by talking a little bit about what MTHFR is. And this, cracks me up because I see MTHFR everywhere. Everybody's talking about MTHFR, but 90% of the time, nobody really knows exactly what it's about. They just know that, oh, it's a big deal. Well, let me tell you what it stands for. MTHFR stands for methylene tetrahydrofolate reductase. It's actually an enzyme, but it is an enzyme that is coded for by the gene with the same name. Now, enzymes are catalysts. They're basically proteins. And by catalyst, I mean that they catalyze or they fuel biochemical reactions. So it's super important that your enzymes be in good shape when you're fueling biochemical reactions because otherwise those biochemical reactions are going to suffer. Now, the gene that is named the same, the MTHFR gene, there's a whole variety of different genes, but there are two that have been widely researched. That's the A1298C and the C677T. And we'll talk about two of over 40 mutations in the MTHFR gene. So what does this gene do? What does this enzyme do? Well, the gene codes for the production of the enzyme, obviously, and the enzyme converts folate. And it converts it into various activated forms. And the reason it does that is because it's the active form that actually fuels the biochemical pathway. And so one is going to help you convert homocysteine and the other is going to help you make neurotransmitters. So the C677T converts folate into methyl tetrahydrofolate, and the A1298C converts folate into methyl tetrahydrofolate to tetrahydrobiopterin, or BH4. So let's take a closer look, and hopefully I won't confuse you too much. Here is a methylation chart. Now, methylation occurs in every single one of your cells, but it occurs predominantly in your liver. And methylation, and we're going to bring my mouse into play here, methylation is predicated on this methylene tetrahydrofolate reductase enzyme. Okay, so let's look at that enzyme. So MTHFR fuels the biochemical pathways that break down homocysteine and that produce neurotransmitters, serotonin, dopamine, norepinephrine, etc. Let's take a look at the 677T first. So the C677T converts folate into 5-MTHF, or methyl tetrahydrofolate, which in turn comes up into the methylation cycle, to the methionine cycle, picks up B12, picks up homocysteine, and converts it to methionine, then SAMe, which then comes back around here. SAMe is a methyl donor and helps you clear out your neurotransmitters, and then also goes on to then produce, again, homocysteine. Homocysteine is also broken down through this shortcut cycle, and it's broken down through the transsulfation pathway, which produces glutathione, which is one of your body's principal antioxidants, taurine, and then sulfates and sulfides down here. So 677T is really the more important of the two. It is the one that you want to be sure is okay when you're going to get pregnant, because 677T is what takes your folate and converts it to its active form of 5-methyl tetrahydrofolate. And that's going to be really important in the development of the neural tube in your developing fetus. Now let's look over here. We're looking at the A1298C. Now the A1298C also converts folate into methyl tetrahydrofolate, but then it converts it into BH4 for the production of neurotransmitters. Now remember that I talked about dopamine being so important because the healthy levels of dopamine keep prolactin in check, so that when you have healthy levels of dopamine, your prolactin is lower, your fertility levels tend to be a little bit better because prolactin isn't inhibiting your ovarian function. Well, there you go. If you're not making enough if you have a defect or variant there, it's going to impair your ability to make your neurotransmitters. So super important to be able to take a look at this and know whether or not you have these variants. And good story is one of my patients actually that we've been working with her fertility, and she's currently pregnant, healthy pregnancy, second trimester, baby's doing really well. But when she came in, she was not able to get pregnant at all, and she had been to a fertility clinic. Make a long story short, we went ahead and measured her six. She she let me basically because I told her, I said, we need to do this, and she agreed. So we went ahead and took a look at her 67017. She had a double variant there. And so we had to compensate for that double variant to ensure that her pregnancy went through in a healthy fashion, because this has the possibility of impairing or not, if you do get pregnant, causing some major birth defects. So let's go on. Why is it so important to have healthy levels of folate? Well, number one, folate supports those rapidly growing cells that are in your pregnant uterus. When that egg gets fertilized, that fertile egg now starts to divide very, very quickly. It's constantly dividing as it's creating or making or developing your baby, right? And in order for that cell division to occur in a healthy fashion, folate has to be present in its activated form, methyl tetrahydrofolate. And folate supports that formation of the neural tube. Neural tube is how you develop your brain and your spine and your spinal cord. So if you don't have a healthy neural tube development, you could wind up with things like anencephaly, or the absence of part of your brain, the absence of your skull. The brain could grow outside your skull, spina bifida. All of those things can be brought about by a lack of folate in the system, or neural tube defects. Other defects that you're going to see with folates could be things like heart and limb defects, urinary tract problems, clefts like lip clefts or oral facial clefts or cleft palates. All of those are brought about by folate deficiency. Remember, folate develops the neural tube. So if you think about a hose, for example, if you cut that hose in half and you split it open, think of that as your neural tube. Folate is the glue that puts that hose back together. That's why it's so important to have healthy levels of folate, so important to have healthy levels of the activated form, which is methyl tetrahydrofolate. So super important to get that checked. So even if you don't want to do a full DNA test, and very often I will run a full DNA test, meaning a full methylation test. So I'll check for that whole methylation map, the one I showed you earlier. But even if you don't want to do that, at least check your MTHFR genetic code. And you can do that very easily through a blood test. Just go get your blood tested, have them check the MTHFR genetic code, and if you have a variant, you just compensate for it. Okay, so let's now go ahead and cover weight and pregnancy. And when we're talking about weight and pregnancy, let's start with obesity. And of course, as you know earlier, when I was talking about the whole fertility issue, I was saying that weight is a big issue, a big cause of infertility, but it's not just about being overweight, but it's also about being underweight. But here, let's cover with the the overweight issues first. So as of 2012, and of course, these stats are constantly updated, 36% of women are obese. 36. Now, obese means they have a BMI of greater than 30%. And of course, there's been an effort to try and reduce that statistic, but instead of decreasing, obesity is actually rising, which is creating a huge problem for women today that want to get pregnant. And the first thing we're going to look at is the obesity trends among US adults. Now, this was in 2009, okay? And you'll see the current statistic, but we're looking at 2000, so it's not like so long ago. It's what, about 6 years ago? You can see that there was only one state that had less than 20% of its population obese with a BMI of over 30. But now look at 2013. This is what, 4 years later? There is no state that has a population with a BMI less than 20%. And the states that have a BMI of 20% are very far and few between. One, two, three, four, five, 6 states, 7 states maybe. The rest of the country has a BMI of, or rather has their population 25% or more. And in 2 states, over 35%, excuse me, of the population has a BMI of over 30 of obesity. It is a huge, huge, huge problem today. And being overweight or being obese is not just about the weight. Obesity carries a gamut of health risks associated with it, from diabetes to fatigue to varicosities to sleep apnea to heart disease, strokes, gallbladder issues. But the biggest problem with being overweight or obese are the birth defects and pregnancy complications associated with being um, being obese. So let's take a look at the impact of obesity on pregnancy. And this is from the American College of Obstetricians and Gynecologists. With obesity, you have an increased risk of gestational diabetes. You have an increased risk of hypertension, preeclampsia, which is that dangerous rise in blood pressure, of cesarean delivery, and of course, difficulty losing your post-baby weight. And in terms of the baby, there's an increased risk of prematurity, of stillbirth, of congenital anomalies, big babies with a possible birth injury and childhood obesity. And the data establishes that the risk of neural tube defects, remember we're talking about that MTHFR and neural tubes, but among obese women, it is double that risk, meaning that let's say that a woman is obese and has that variant, that 677T variant, that is an absolute perfect storm and a recipe for disaster. So it's so important to take a look at all these factors before getting pregnant. Now, ladies, if you're underweight, you are not out of the woods here at all, because underweight women are at a greater risk of miscarriage. Okay, greater risk by 72%. So if you're underweight, you run 72% risk of suffering a miscarriage in the first 3 months of pregnancies. But the beauty of this is that can be reversed. And it can be reversed by just eating properly, bringing your weight up, and reducing stress when pregnant. So super important to look at this. Now let's take a look at insulin resistance, diabetes, and pregnancy, and that another huge issue today. So if we look at these stats from 1994, okay, now remember I showed you the stats from 2004, from 2009 on obesity, just a few slides ago. Now take a look at this. This is 1994. This is obesity. People had a BMI of greater than 30 uh, in, back in 1994. So we're talking, let's see, 20 years or so ago. Look at this. Most states, it was less than 14% of their population were obese. Some were 14 to 17%. But it was not this rampant growth in obesity that you see today, right? Look at diabetes again, same, kind of really low, the sort of whitish colors are sort of lowest statistics, much healthier appearance to the country, right? Now look at 2013. This is a calamity, absolute calamity. We know for sure that the obesity rate has increased dramatically, and diabetes seems to have come up with it. So let's look at obesity versus diabetes, and you can see that they kind of are going hand in hand over the years, 94, 2000, 2013. Instead of getting better, things are just getting worse and worse and worse. So let's look at some blood sugar facts. As much as 67% of the population has some kind of blood sugar imbalance. 67% of the population. And insulin resistance, which is one of the biggest issues out there, is connected to pretty much all of the chronic degenerative diseases. It is a precursor to metabolic syndrome and diabetes, and has been linked to cancer, to heart disease, to depression, polycystic ovarian syndrome, neurodegenerative disorders like Alzheimer's, dementia, Parkinson's, high blood pressure, fatigue, and so much more. Now, again, I've done a lecture or video on blood sugar, on sugar rather, which you might be interested in watching as well, just to get an understanding of how pervasive sugar is and how it's in every part of our diet. So look at this information on pregnancy and diabetes. And this information is actually provided by the CDC in a pamphlet called Pre-existing Diabetes and Pregnancy. In the pamphlet, they talk about the effect of diabetes on the mom and the baby. So for the mom, it talks about worsening of any existing problems, whether they're eye, kidney, etc., that have already been caused by diabetes. As you know, diabetes tends to have a lot of issues that accompany it. Things like eye problems, loss of vision, circulatory issues, nerve issues, etc. So with diabetes, if you already have these kinds of problems, they will be made worse during the pregnancy. The other problem with diabetes in pregnancy is that labor may start too early, meaning you might wind up having a premature baby. The bladder and other infections happen during diabetes and pregnancy. Gum disease, injury from delivering a big baby. You're not only going to injure the baby, but you're also going to injure yourself, especially if that baby is being born not cesarean, but vaginally. You could have tears, you could have injuries that can both affect you and the baby. You may have to have a cesarean section. You may wind up with high blood pressure or preeclampsia. Now, for the baby, it's even worse. We are looking at potential birth defects, some heart defects like holes in the heart, some major deep vein defects of the brain and the spinal cord, which we spoke about. Remember when we talked about the fact that obesity, which accompanies diabetes very often, is runs the risk of higher risk or doubles the risk rather of neural tube defects, again with folate issues, stillbirths and miscarriages, big babies that could injure their collarbones or have broken bones or injure their nerves if they're being delivered, low blood sugar after birth, jaundice, and of course obesity later in life. So it's really something that you need to absolutely consider before you get pregnant. But the beauty of diabetes is that studies have shown that diabetes is 100% reversible with dietary changes. Now, here we're talking about type 2 diabetes. Type 1 diabetes is unfortunately an autoimmune disease, but that doesn't mean that it can be somewhat managed. Just know that there are definitely answers for these issues. In fact, one of my patients who is a type 1 diabetic had a very fine pregnancy and a beautiful baby. And the baby is in wonderful shape, very healthy baby. Everything is looking really good with her. And she is type 1 diabetic. So you can see that it isn't at all a hurdle. It's just something you need to be aware of and something that you need to make sure that you manage before you get pregnant. Let's take a look now at adrenal fatigue and pregnancy. And I think here's where I mean we know about thyroid, we know about weight, we know about alcohol, we know about diabetes, etc. But I think adrenals, the adrenal glands are very often overlooked when it comes to overall health and when it comes to something like pregnancy. So let's talk a little bit about your adrenals. Your adrenals are your stress adaptation gland, and one of the principal hormones that they produce in response to stress is cortisol. Now, cortisol in healthy levels is anti-inflammatory. It helps to regulate blood sugar. It helps to regulate your circadian rhythm. But in unhealthy levels, it actually does the opposite. It becomes inflammatory. It causes your blood sugar to stay high, potentially throwing you into an insulin resistant state. It has the potential to disrupt your sleep. It has the potential to tear or wear down the hippocampal portion of your brain and impact the hypothalamus. It has the potential to elevate your blood pressure. So it's extremely important to manage your stress before pregnancy. Now let's take a look at adrenal insufficiency in pregnancy. And this particular study was published in 2013. Even though it says adrenal insufficiency in pregnancy is relatively rare, we know that to be not so true, but it is, but this is a study, so we're going to go by it. But it is what they say is it is associated with significant is the key word here, maternal and fetal morbidity and mortality if untreated. So important to ensure that that adrenal is treated. Now here's another one. This was published in the Lancet. This is one of the British medical journals. And this is the study is congenital adrenal hyperplasia. Now, what they talked about was congenital adrenal hyperplasia being due to deficiency of 21 hydroxylase. Now, they talk about it being a disorder of the adrenal cortex characterized by cortisol deficiency. I just want to kind of sidetrack a little bit and talk about 21 hydroxylase a little bit. 21 hydroxylase uh, helps the conversion of 17 hydroxyprogesterone to cortisol. Now, when you have an autoimmune thyroid issue, you could potentially also have autoantibodies to other parts of your system. And it is not uncommon to have autoantibodies to 21 hydroxylase, which leads you to have constant low cortisol or cortisol deficiency. So, having said that, knowing that you have a low cortisol has an impact on neonates or on your baby. It causes them to be particularly vulnerable to hypovolemia, which is low blood volume, electrolyte disturbances, hypoglycemia, which is low blood sugar, and increased mortality. And it causes them to you to or women to be infertile rather. So having said that, it isn't kind of unusual to wonder, well, what if I have adrenal fatigue? What if my cortisol levels are so low because I'm so wiped out and I'm so stressed out? Is that going to impact my fertility? Absolutely. Because here they're talking about a congenital adrenal hyperplasia due to deficiency of 21 hydroxylase, but the bottom line is it's low cortisol, and low cortisol has an impact on your pregnancy. So it's extremely important to ensure that your adrenals are healthy before you get pregnant. So how would you know? Well, most conventional doctors really never bother to check the adrenals, probably because there's really no medication, if you will, to treat that. I mean, they do use hydrocortisone sometimes to help bring up your cortisone levels. But the problem with that is anytime you use a hormone in your system to do something, it suppresses the gland that makes that hormone. So it's kind of, again, a two-edged sword. You might feel a little bit better, but in the long run, it's really going to suppress your own body's ability to restore its adrenal health. Now, if you want to take a look at your adrenal health, the best way to assess that is with salivary testing. Although there are some newer methods that are coming out that involve or dried urine rather, um, the salivary testing is still sort of the gold standard. And you have to remember that your adrenals are impacted by stress. They're your stress adaptation glands. So whether you have internal stress, let's say you're a diabetic, or you have food allergies or something else, if you have an internal stressor, that's just as much of a stressor on your adrenals and just as much of a need for you to adapt to that stress as an external stressor rather, a bad job, a bad marriage, a bad whatever. So either way, you're going to be likely to have an adrenal issue, and it is something that you absolutely want to explore before you jump into a pregnancy. So let's say you looked at all of these and oh my goodness, you've got all these different things going on. What can you do? Well, there are some things you can control. And when I talk about things that you can control, I'm talking about things like your diet. You know when it comes to food diet, I am a sort of I dislike, let's put it that way, extremes in any directions. I don't like extreme diets. I don't like extreme eating habits. I feel and believe that the healthiest diet that you can have is one that is varied, that incorporates animal protein, that incorporates lots of vegetables, that incorporates fruit. I believe that it is super important to eat a very, very varied diet because you derive nutrients and nutrition from every single food that goes into your body. So these are things you can control. How you eat, your lifestyle, what you do to decompress, how you y- avoid, say, pesticides and herbicides and things that have the potential to toxify you. These are all things that are within your control. So start taking control of your life now. Start taking control of your health. Start taking control of your diet. Understand that you can't really have a healthy body without some animal protein. You need protein to make your hormones. You cannot make your thyroid hormone without protein. You cannot make your neurotransmitters without protein. You cannot build muscle, organs, glands. You cannot do anything. Healthy skin, healthy babies without ample amounts of protein. So make sure that you eat that varied diet, one that's going to provide you with all of the nutrients that your body and your developing baby need. Now, there are some things you can't control, things like your genes and your DNA, for example. But if you do happen to have a variant, you can compensate for it. And there are many women out there that have these variants that have been able to compensate for them and have perfectly healthy babies. So don't despair if you have something that is out of your control, something that you cannot change, because you can always compensate for that. And that makes a world of difference in maintaining and having and maintaining a pregnancy. So the bottom line, what you must do, well, you must get checked before you get pregnant. Remember, you need to remember that your baby didn't ask to be born. They didn't ask to come into this world. So it's your responsibility to ensure that he or she has the very best start in life by taking care of yourself first. It's like when you're on an airplane and you're getting the safety instructions. When they tell you, should the cabin lose pressure, what you're supposed to do when if you happen to have someone, a child with you, you put the mask on your face first and then you put the mask on your child's face, because if you pass out, you're not going to be any good to your child, right? Same thing. If you are ready to have that baby and you know that that baby is going to depend on you while it's gestating to get its nutrients and everything that it needs to develop properly, you better be sure you're healthy before you do that. So the bottom line, obviously, is you have to be healthy to have a healthy baby. So I want to thank you so much for joining me. If you're looking for me, you can find me at drnadiamalik.com, or you can check out my business page on facebook.com/Malik Clinic. Now, I do have a blog on my website, drnadiamalik.com, and I do blog. So you will have an opportunity to get new information, any new research that I see, and I do also post on the Facebook, so you can always go there and check things out. I thank you so much for joining me, and I hope to see you next time.